Hello and welcome to our panel discussion, Positive Health Careers, Shaping a Healthier Future. I'm Dr. Mary Collins from the RCSI Centre for Positive Health Sciences. I'm really delighted to be joined by three panellists today. Firstly, I'd like to welcome Professor Ciaran O'Boyle. Professor Ciaran O'Boyle is a Professor of Psychology and is the Founding Director of the RCSI Centre for Positive Health Sciences. Ruth Kelly is a Chartered Physiotherapist and Positive Health and Wellbeing Coach, and Ruth is a current scholar on the MSc in Positive Health Coaching here in RCSI. And welcome to Dr. Mark Rowe. Mark is a medical doctor, author, TEDx speaker and leader in lifestyle medicine. So welcome to all our panel, and we'd like to get started by getting an insight into your career journeys and what brought you to this point in your careers. Let's get started by hearing a little about your career background and what has brought you to this point in your career. So Mark, can we start with you, please?
Absolutely, Mary. Thank you so much. You know, I always say I'm very lucky in the work that I do. I started out in general practice and I've been working as a GP now for nearly 30 years. But during the great economic crash in 2008, suddenly I was dealing with lots and lots of patients who were really struggling with serious financial pressure, mortgage issues, bank issues, in many cases losing their jobs. And as I say, more than pills or Prozac, people needed a new sense of purpose and meaning, and that's really when I went off and began to learn about these really interesting ideas in philosophy and in positive psychology and in the idea of lifestyle as medicine, the idea that your everyday lifestyle habits can make such a tangible difference, not just to your health span long term, but more importantly, to how you feel. And bringing these ideas into my practice with my patients, I saw real benefits. People began to keep gratitude practices, keep journals, began to reframe challenging experiences and reframe setbacks through the lens of growth, through this idea of post-traumatic growth, that we can learn from our adversity, we can learn from our setbacks. And, I think in life, once you see things differently, there's no going back to the old way of being. And that really set me off on a huge journey of self-discovery and of learning that I'm still on. And it's a very, very rewarding idea that you can support people more effectively to become more active participants in their own well-being, as opposed to simply being passive consumers of healthcare.
Wonderful, thank you, Mark. And you've got a thriving practice at the moment.
I'm very lucky. I work with 25 other people. We've a great team in Waterford City, in an old convent building that I restored in 2009, and it's a great privilege to do the work I do, but it's very much a team-based approach.
Great, thank you, Mark. So Ciaran, can you tell us a little about your career to date and what brought you to the whole field of positive health?
Thanks, Mary. In a funny way, it's bringing me back nearly 40 years. I started life as a scientist working in St. James's Hospital in pharmacology and in psychology, and we were very interested in stress and stress mechanisms, but we didn't know anything about those mechanisms like we know today. So I joined RCSI, was psychology professor here, set up an Institute of Leadership, and then we started hearing in the leadership literature about positive psychology and positive organizations. And we started to discover that there was a science behind this, a new science emerging really from about the 90s. So we started integrating that and teaching, people how do we create positive organizations. And then brought us on to lifestyle medicine. So we started hearing about this new specialty emerging that really had a very solid scientific basis, but gave us a framework for thinking about how lifestyle is medicine. We found that very interesting. So we then decided here in the RCSI to set up a new centre, and we call that centre the Centre for Positive Health Sciences. And I suppose the most important word in that is sciences, because it's an evidence-based centre. So that's been such an interesting trajectory, a great journey, because I have found that not only is the material and the research outcomes, good for organizations and for people. It's also good for me personally, because I've been able to change my own lifestyle. And that's what brought me here.
Wonderful. And Ciaran, the centre started life as the Centre for Positive Psychology and Health. Can you just share with us why you evolved it into positive health sciences?
Yeah, we first came into this space, I suppose, through positive psychology, the idea that psychology needed to integrate research about what's good about life, what's good about people, what are the positive sides of psychology. We know a great deal about anxiety and stress and depression, but psychology didn't know a lot about the upside of human nature. So that brought us in, and then soon after that we discovered, it was broader than that. There are other positive health sciences, health psychology, behavioral medicine, for public health medicine. A lot of that is really about improving the lot of people through changing how health works at a public level. So that gave us a broader base, and we felt that really positive health sciences, captured more of these scientific disciplines that are emerging, and that's why we shifted to calling this the RCSI Centre for Positive Health Sciences.
Great, thanks Ciaran. And Ruth, you started life as a chartered physiotherapist. So can you tell us a little bit about your career trajectory?
Yeah, I did, Mary. I qualified as physio a long time ago, and I started off in hospital. I worked in hospital for about 6 years, and then I worked in the community and in private practice for a year before going off to America for a year. And I came back and I set up my own practice in 1992. And I was really based in orthopedic medicine, so it was musculoskeletal stuff. And I had great fun. I felt a bit like Mark. I felt so privileged to be working with people, because everybody that came in the door, I wanted them to feel somewhat better for having spent half an hour or an hour with me. And physio was a real tool to do that. And looking back, now I see that even back then in the physio practice, and I would say most physios today would probably say they bring in a lot of lifestyle medicine stuff into their practice. I tried physio, but it was hard on my joints, and I thought this won't last a long time. So I was waiting to see what I would do. And I was involved in some things in the community, with some community groups as a volunteer. And then I saw I wanted to go back and learn more and retrain as something, and I saw the course in positive health. And I signed up for it, and I did it, and it was absolutely fantastic. I suppose I wanted to change career or add to my career. I knew I couldn't work as a physio, and I was seeing what might come towards me. But the positive health, for me, I suppose I saw a lot of what I already did in the lifestyle medicine. With patients, we would have always got them exercising. I was aware, we didn't have the science for it. It was magic. I nearly get goosebumps thinking about it, because actually we were doing stuff that now, when I did that diploma, I saw you all have the science, and you shared that fabulous science with us. So then I started working. I had done a couple of coaching courses, the personal executive and leadership coaching, and the mental health and wellbeing coaching. So I decided I would work as a positive health coach. So I'm currently working part-time as a positive health coach and part-time doing my master's. And for me, as I'm not sure where I'm going to land, but there's no doubt the education that I'm getting here from this institution is really leading me to something where I hope to be in a position to influence people. And I know I already am, because at the end of I give a lot of workshops and I do a lot of group coaching, if you like. And at the end, I will always ask for comments and feedback. And the feedback is extremely positive. If I could get feedback like that from my family, I'd be a very happy woman. But and I'm just sharing the principles of lifestyle medicine, which we knew, and everybody knows it all. But when you top it up with the positive psychology interventions, I think it becomes almost something magical. Only it's not magical, because it happens and it's repeatable. So when, like you were saying, Mark, by bringing in gratitude and savouring and hope, introducing hope, you can help people change a lot for themselves. And then when you're bringing in the coaching approach, So you're believing that people have their own answers to their own questions. So all we have to do is empower them. So it's an absolutely fantastic journey that I'm on, and I hope I'm going to make a difference. And I think there are a lot of possibilities. I'm just currently doing this master's, I'm in year 2. So I think the future, there's a lot of possibilities. I see a lot of opportunities and a lot of doors that could open. So that's where I am now.
That's wonderful. Thanks so much for that, Ruth. And I think I recall you saying to me once that lifestyle medicine and positive psychology was almost the icing on the cake.
Oh yeah, very much.
Yes.
Yeah, and I think practically, I find that, well, even this morning giving a workshop to older women, and it's the second of 2 workshops. And when you bring in the broaden and build theory, they can see, and if they can experience their positive emotions, everything will be a little bit better. So even that motivated them to walk for the 5 minutes more and celebrate themselves and feel better about themselves and go in and cook a better dinner. It's almost as simple and basic as that, which in practice has a big impact on the lives of individuals.
Absolutely, absolutely. Thank you, Ruth. So this whole discussion really is born out of queries and questions and emails to our operations team around we're really interested in this topic. We love lifestyle medicine, positive psychology, positive health, but what can I do with this? What are the future career paths for me? So that's really where we decided to run this session. So I'm curious to hear from you, what trends are you seeing and what future opportunities are there in this positive health space? So maybe Mark, I might go to you, please.
Oh, I think there's never been more opportunity and never more need for us to begin to look at health, which ultimately is the greatest asset any of us has, more broadly and differently, because health, of course, is more than the absence of being sick or unwell. It's a state of complete physical, mental and relational well-being. And if you look at how much anxiety and how much stress and how much unhappiness there is in modern life, on the one hand. On the other hand, if you look at the tsunami of chronic health conditions from diabetes to dementia, heart disease that are here now and coming down the track, on top of an aging population, there's never been more opportunity for a message that says, on the one hand, we can support you to reduce your risk of becoming unwell, but more importantly, we can give you the skills and strategies to increase your health span, meaning the number of years you can live healthily. With a modicum of good luck, you might even live a bit longer, but none of us can guarantee that. But perhaps more importantly, we can improve your subjective lived experience each and every day. Not just giving you the skills to make the best of good times, but the resilience to cope with the inevitable challenges and tough times that we all face. And I think really it's about starting, if you're listening to this and you're interested in learning more, and I think that's great to learn more, never stop learning, never stop starting. Start right wherever you are today. It's not perfect. Start with the discomfort of today and simply start. And just explore how you could bring one tiny intervention in this topic called lifestyle medicine, which is very broad. It's your interpersonal relationships, it's recharging from stress, it's exercise and movement, it's nutrition, it's sleep, it's avoiding noxious substances, it's underpinned by the environments we spend our time in. What's the smallest thing you can do that could make a little difference in your own health and well-being, firstly? And of course there's all the positive health practices as well, from a gratitude practice to mindful breathing to reframing. Just start small. And as you see how that impacts your own well-being, you can learn more. And there's wonderful programs here now. Obviously, we're here today talking about the RCSI. There's fantastic programs here to deepen your knowledge. But it's adopting that mindset of learning, continuous learning. And what's really fascinating is how positively contagious our actions and choices and decisions really become. How you becoming better to yourself through more self-care strategies and self-compassion can positively cascade to impact people in your family, people in your community, and people that you work with. And I think that they're really the two things, you know, how can this impact me from a personal point of view, and then how can it come more into my professional life as well.
Yeah, that's great, Mark. So really living the values yourself first. And I really like that idea of the tiny habits, you know, starting small with achievable practices, and then changing your mindset, really. Great.
I think one of the things that's most misunderstood in this whole idea of making change, and of course change is never easy, it sounds so simple but it rarely is the value of time. It's the magic ingredient. Small changes compound over time to create amazing results.
Great, thanks Mark. So Ciaran, if I can go to you, because I know the Centre has been doing a lot of work around defining positive health. So can you share a bit of that with us, please?
Yeah, we've been on a journey to try to get a model of positive health that makes sense, you know, that is underpinned by the science. And where we've got to with that, we're just publishing the International Handbook of Positive Health this year, later this year. So where we've got to is if we think about it as a continuum, from one side of the continuum is serious illness and disease, and the other side is absolutely thriving, you know, psychologically, physically, in terms of meaning, socially, and so on. And we're all somewhere on that continuum. So I tend to think of it as -10 down here, the disease part, and +10 up here, the really, really positive part, with 0 in the middle. And it's really interesting, if you look at the 0 to -10, that's really what our healthcare system has focused on up to now. You know, in many ways rightly, it's illness and it's disease, and we're pretty good at managing and treating that by and large. But then you start to ask the question, what about 0 to +10? What's that like? What's it actually like to absolutely thrive, to be so well that you're kind of, you know, bouncing along? Not many people are up there. If you ask people, you know, are you well? They'll say, yeah, I'm well because I'm not sick. So we've tended to define being well as not being sick or not having a disease. So we see positive health as two things. One is that the end of that continuum where it's absolutely, you're doing brilliantly, you're thriving, you're flourishing. But more than that, anytime you move on the continuum in that direction is part of a positive health journey. So I could be quite ill, you know, and start to improve a little bit, and that's a positive health kind of journey. And that's a much broader way of thinking about health than we generally do in training in the health professions. So when I think about our programs, professional diploma in positive health, masters in positive health coaching that Ruth is doing, we're bringing in a new one on leadership in wellbeing in the workplace and the masters in that. What we're trying to do is really to help professionals, both health professionals but also teachers perhaps, we've got some politicians, we've got business people, to help them start to think about this new way of thinking about health and to learn the knowledge and the skills, A, to change themselves, to improve their own health and well-being, but B, then to have an impact on their patients or their clients or on their organizations. So we would see teachers learning about this can actually really impact on young people, children. And we know that there's an epidemic of mental health problems in young people now. You know, somebody in the business community learning about this, starting to change the way an organization functions, can have a massive impact on the quality of well-being in the workplace. We're passionate about public education as well. We want to give as much access as possible to people to this way of thinking and to the science that underpins this. So they can start then, as Mark says, they can start then to improve their own health and well-being one step at a time, but also that of their families perhaps, and perhaps their communities. So we're on a mission really to shift the way we think about healthcare. No small job.
Wonderful, thanks Ciaran. So when we consider the whole area of interdisciplinary collaboration, so if somebody's watching this that's a nurse or a midwife or indeed a physio, Would anybody like to share any insights on how you're seeing that interdiscipline collaboration happening at the moment in healthcare?
I'm very lucky as a GP. I work with an amazing team of people, and our building, the Waterford Health Park, we also have a primary care team on site, public health nurses, physiotherapy, and we have regular primary care team meetings where you can share and discuss complex cases and so on. But I really think there is so much potential for us to learn from each other, and we all see the world through our own eyes, through our own lens, and through our own upbringing and how we've always done things. But really we can learn so much from others, and I really think that there's such untapped potential in the whole healthcare system, healthcare community, to reimagine how people do meaningful work and to really focus much more on a team-based approach from a safety point of view, from a quality point of view, and from a a well-being and job satisfaction point of view as well. I think we can learn so much from others, and I actually think if you're interested in learning more about positive health and lifestyle medicine, doing some of the courses that are now available in the RCSI, it's a wonderful opportunity to learn collaboratively from the other students who, like you, are going to be coming to this from very different and diverse backgrounds. And that really, for me, that really enriches a learning experience to share from others, the sort of the offline conversations and sharings that can really deepen and enrich that learning journey and that learning experience.
Great, thanks Mark. And I might just go to Ruth, because Ruth is a current scholar on our Masters in Positive Health Coaching. How are you finding the different backgrounds and professions on the course, Ruth?
Oh, yeah, it's wonderful. We have a wonderful mix in our class. There are nurses, there is a yoga teacher, yoga practitioner, there is a psychologist, there's a coach, a sports coach, and everyone brings something different. And then our tutors are fantastic, and the literature we've been given to read. So it's a real, we're all growing as I see it. And that growth, what we're learning is really changing who we are. I see a huge transformation among the class. We're a small class this year, and which has advantages and disadvantages, but we know each other really well. And we have all grown so much in just 1 year. And I think going forward then, we can see the way we learn from each other and collaborate with each other. So then as a career going forward, you can see ways that you could support each other. Even some of us with our experience in the community, others in hospitals, others coaching people, whatever it is, we can support each other and learn from each other. And again, as I suppose we're all thinking about our career and our next step, because that's what we're thinking of, and we're doing this and we're wondering where we'll go. And with our wide, the variety among us, we have a variety of talents and interests. And in reality, I believe if we each keep moving towards our real area of interest, that we'll find something that will be right for us. I think it's a new profession. I think there's not a lot of jobs made yet, but I think we'll be able to forge a little way. For example, as a physio, using the coaching, and I'm no longer working as a chartered physio, I work as a health coach. So I'm using my physio experience to forge my way, and most of my work, as I said, is in the community. But I see that I could really collaborate well with GPs when I'm finished this, and work with groups of patients, you're pre-diabetic, you're cardiovascular disease, and actually mix those patients together and do group coaching, which I know could work extremely well, and the patients could really learn from each other and motivate each other and have a bit of fun. And I see huge potential for that actually, and I see huge potential in schools. And so I think there's a lot of areas that bringing these diverse people together, we can go diverse ways and support each other on that journey, learning from it. It's all about learning, moving forward and learning.
Yeah, absolutely. And I really like you mentioned the diversity in the class, but everyone is following their own passion and their own path. And it reminded me of that Japanese concept of ikigai, where we have the 3 interlapping areas. And I think anybody who's watching this who maybe is a little bit confused about the next step, I think a good starting point is to focus on your strengths. You know, what are you really good at in the world? And importantly, what are you passionate about? Because you could be very good at something, but not be passionate about it. And then the third in the Venn diagram, if you think the strengths, the passion, and then what does the world need and where can you get paid? You know, we're talking about careers here, so we have to be realistic. And I think that's the sweet spot at the centre of those 3 areas. So can we talk for a moment about the role of technology and how that is transforming this whole area, and the pros and cons of technology? So maybe Ciaran, I might go to you on this one, please.
Yeah, it's such an enormous area, Mary, and you know there's been some fantastic science and research emerging in the whole area of cyber psychology, and some of the leaders in that space are here in Ireland. So I think technology is a double-edged sword. I think there are some fantastic positives with technology because it's in healthcare, it significantly increases access for people, you know. So we're working on a major project, one of our colleagues, Dr. Padraig Dunn, looking to see how we can use technology to make healthcare coaching available to much larger numbers of people. So there's an example. I think healthcare is going to be radically transformed over the next 10 years through technology in all kinds of ways that we can't even see yet. I think artificial intelligence is going to have a massive impact. And I think parts of that will be fantastic. I think parts of that will be really good. I do think, though, there's a downside in that, particularly for young people. I think part of the whole challenge that we have with mental health in young people is driven by a particular way of using technology. Vikram Murthy, the Surgeon General, wrote a whole advisory on this where he said that this generation of young people, they're the most connected ever, but the loneliest. You know, and there are ways in which we're taking technology for granted and allowing its influence to just keep growing, and I'm particularly worrying with our artificial intelligence. So I think that this is an area where helping to empower people to improve their own health and well-being, training people to intervene in schools, in the workplace and so on. You know, technology lends itself very well to this area, but then I think we also need to have education and training around what the possible downsides of technology are.
Yeah, absolutely. Thanks, Ciaran. And Mark, there's a lot of influencers out there, a lot of social media talking about wellness and lifestyle. What are your thoughts on that?
Well, knowledge is power and we need advocates, but I really believe that you need to ensure that the source of your information is an authentic, trusted, reliable source. And I really feel that there's, you know, you really need to look at how medical professionals and fully trained and accredited psychologists can really provide the backbone of this wellbeing information. Unfortunately, all information isn't the same. And, you know, some people can be vulnerable and some people can be exploited, particularly as Ciaran was saying, with mobile phones and social media and so on. It's very easy for people to end up down this rabbit hole of being exploited. And you know, while I'm a great believer in advocacy as a doctor myself, I really believe that you know, actions speak louder than words, and you know, yeah, we have a very important role to educate and empower others. I really think it all does come back down to education. If people know more, they can do more. They can make better choices and decisions. I just think while you are really in that space of learning and exploring your interest in health and well-being, make sure that you're listening to trusted sources, because really it can be so important.
Absolutely. And Mark, have you any advice for somebody who's out there looking at different, perhaps short programs or educational qualifications in this space, any advice to help them filter out the authentic from the invalid ones?
Well, I think the course here in the RCSI is excellent, and I mean, I've been a guest lecturer on it for several years, and I've got to know some of the participants who have found it very, very useful and very valuable in their, either in their current career to support them in getting more fulfillment and meaning, and in their own personal lives, and then sometimes, as Ruth said, in terms of making a career transition to maybe more into coaching or teaching or into an educational role. But really it does come back to just starting wherever you are and exploring the small steps and the small ways that you can learn more. And it's amazing how, you know, that thirst for knowledge and that desire to learn can really create some serious momentum over time.
Thanks so much for that, Mark. Ciaran, can I turn to you? We've spoken a lot about healthcare professionals transitioning into this positive health space. What about somebody who doesn't have a background in healthcare? Are they still open to joining the programs?
Yes, they're really welcome. I mean, in our way of thinking, we want to scale up the impact of this kind of science. So if we look at our alumni over the last 3 years now, we have teachers, you know, who came into this space because they wanted to improve things for their students at primary school, secondary school, at college level. This is becoming a much bigger issue in the education. We have people who have backgrounds in healthcare, yes, but maybe in other teachers indeed and other professions who want to kind of come into this new industry. It's a $1.5 trillion industry according to McKinsey's wellness and wellbeing. So they want to transition into that, but need a foundational program to help them to understand what the frameworks are. And then we have a lot of people starting to come into us from the world of work. So not just from human resources departments, although many people from there, but managers and leaders who say, you know, if we improve the workplace and, you know, create an environment where people are much more positively healthy, well, that's good for them, but it's also good for productivity, you know, and it's good for the bottom line. And we've got people coming in from the social works, and again, who want to see a different kind of science. So the professional diploma in positive health, we see that as a sort of a gateway, an entryway, not just for people from the positive health professions, but also from a range of professions. I could include law in that, for example, who want to get a grounding in this new approach to healthcare and then move off out of that, either in their own careers as, you know, sole practitioners, or within their organizations, within their school systems, within the legal system. So it's geared for that range of different interests.
Yeah, absolutely. So very much when people are at that transition point.
Yes, and the other thing I would say, and it reflects my own experience, I think probably Mark's and Ruth's, we were trained, you know, in our professions, in our disciplines, you know, and, you know, very well trained. But you leave something behind when you go down the pathway of a profession. You know, Carl Jung said, you know, the job of adulthood is to bring back the bits of yourself you've lost along the way. And I think this way of thinking about health, being as broad as it is, allows us to go back and revisit, you know, perhaps areas that our professional development may have left underdeveloped. And I think it's one of the real attractions of this approach to healthcare. I don't know if Mark and Ruth would agree with that.
Oh, absolutely. I think we're, you know, in life, we're all works in progress. And I really think, you know, positive health and lifestyle medicine can really help us all to kind of square the circle in terms of, you know, self-actualization, in terms of self-development, and really, I suppose, rediscovering the essence of who we are. Because I think when you do get into the second half of your life, you do start thinking more about contribution, significance, and how can you positively impact the generations that are coming behind us. And I think, you know, learning from our experiences and the science and evidence that's really growing now in this really exciting area is a wonderful way to do that.
I think that's brilliant. I agree with you there, Mark. And I think then, even if you bring the coaching approach, so you're seeing how to live with the lifestyle medicine and the effect that the positive psychology approach can bring to all of that. And then if you come to all of this with a coaching approach, believing that people around you are able to find their own answers and find within them the strength and the ability to do whatever actions they have to do. So we can just empower them to do what is necessary. And if they get the leadership, if as positive health coaches and positive health practitioners as we are, if we give the leadership and show the example, hopefully that will help to empower them to follow and find their own base, because for everyone that will be different.
Great, thanks Ruth. And can we talk for a moment about entrepreneurship and positive health? Because if somebody's watching this, who's very keen to set up their own business, or perhaps they have a business and they want to add positive health to it, what advice or guidance would you have for them? So I might go to Mark on this one, please.
I'm just thinking in real time about Newton, Isaac Newton. He was sitting outside in nature under an apple tree, and when that apple fell on his head, he came up with his law of gravity. What goes up must come down. Being in nature inherently makes us so much more creative. It's really interesting the positive impact that environments can have on our thinking, but it's also true for our everyday lifestyle habits and for the things we choose to focus on in terms of the positive health practices. It can make us more creative, which makes us more entrepreneurial. And it can open up new pathways and new possibilities in your brain and in your thinking and in your mindset. And there's a lovely phrase that says, none of us can go back to the beginning and start again, but starting today you can create a brand new ending in your life. And if you are entrepreneurial, and if you are interested in exploring how you can have more of an impact yourself in your career or in a new career that you're going to go and embark on, I think having the science of positive health, having the foundations of lifestyle as medicine will really not just stand you in good stead, but will make that journey more exciting and ultimately more rewarding for you too.
Lovely, thank you, Mark. And Ruth, you're a fellow entrepreneur, so what advice would you have for somebody?
I think follow what you're interested in, and particularly in this area, it's all new. And I think if you feel passionate or particularly interested in something, just go for it and doors will open. I know personally, as I'm on my journey, I'm not quite sure where I'll land, but I see a lot of doors, a lot of possibilities. And I suppose we're also aware about health and wellness. I mean, it's what it's all about, particularly as we get older. And Mark, you're talking about getting older, and as we get older, it's we want to be well. And there's no doubt about it. What I really love about all of this, it's based on science. What we base our practice on is backed by science. So if there's something you're interested in, move towards it. And there are a lot of little areas that we don't even know about yet where you can find jobs. So I'd say follow your little heart and have the science, be well educated, have your knowledge, have your pack of knowledge, and go towards what you're interested in. And if you don't like it, move. You can always change, nudge your way one way or the other and until you land where you like and enjoy the journey.
I mean, that's the thing, as Ruth said, change is constant for all of us. And the question is, are you changing in a health enhancing or health depleting direction? Not just in terms of your physical health, but in terms of your thinking.
Yes, yeah, absolutely. And Ruth, you mentioned something really interesting there, that there are a lot of careers and roles and jobs that perhaps don't even exist now. If we look 5 years ahead, and I know, Ciaran, you've spoken about this before.
I mean, I'm surprised. I have been surprised, I must say, Mary, at the size of the interest that there is out there in this area. Some people might call that a market. We did a program during COVID where We produced a course online which was free. It was 10 lectures. We called it The Science of Health and Happiness. I think we expected about 400 or 500 people to sign up for that, and nearly 40,000 people signed up for it. So, you know, there's a great hunger out there among the public to have access to this kind of knowledge, you know, validated knowledge. So I think there's very healthy prospects for people getting into this space who can provide this kind of knowledge, you know, who have the background and who have the training to do that. I think healthcare is going to shift, because it's going to have to, and government policy is going to have to shift. We're still going to have to treat people, obviously, who are, you know, have chronic conditions and illness, acute illnesses and so on. But in addition to that, it makes a great deal of sense for government policy to invest in prevention and in health promotion. So that's about public health, but it's also about this kind of positive health. So we're going to need new experts. We're going to need people who are able to do that. And that's opening up this whole new type of I don't know, call it industry, call it service, you know, that is only going to grow.
Mm-hmm. Yes, it's a very exciting time. So as we come towards the end of our discussion today, I would love to ask each of you to share one nugget of wisdom. If somebody is watching this and really wants to make a career move or start a new business in positive health, what is the one piece of advice you would give them? And I might start with Ruth, please.
Well, I would say get educated. Do inform yourself, do the course, and certainly to live is to change, and everything is changing. So get educated and move towards what you want and enjoy it.
Great advice. Thanks, Ruth. Mark?
As Ruth said, you know, change is constant, and I would say start where you are, be kinder to yourself, value yourself, treat yourself well, and nurture that interest you have in learning more about what makes you tick, about how you can improve your interpersonal relationships, how you can improve your performance in your career, how you can engage more with your family, friends, community. It's really by asking those questions you'll come up with your own answers. But what I want to say to anyone listening is that, you know, lifestyle medicine and positive psychology can really provide you with a lot of answers. I won't say it'll give you all the answers, I don't think anything does, but it can give you a lot of answers which might provide the basis for further interesting questions.
Wonderful, thanks Mark, and I love that start where you were at.
Absolutely.
Yeah, thank you. And Ciaran?
So if you're somebody who, you know, you're a professional, you're thinking about doing one of these programs and you're asking the question, is this for me? Well, I think the first thing is come onto our website and look at the resources that are there. I'd suggest doing the Science of Health and Happiness program online, because again, you know, you get a sense of what the material is and, you know, get a sense of the science. I think Mark has done some very nice lectures and presentations, his TED Talks, you know, so there's another way of getting access to it. So learn a bit about the space. And then, you know, anybody who's interested can always talk to us, any of us on the team, either in the faculty or in the office, you know, to work out, you know, is this the direction for me or is this the program for me? And in fact, many of our scholars who are now on the program, have completed the program, have done just that. They've contacted us and said, I'm thinking this way. And, you know, we're very open to saying this might not be the right program for you at the moment, or yes, this is something that makes a lot of sense for you. So that would be the step that I would take if you're contemplating doing one of these programs.
Fantastic. So the common thread really is learning, education, building your awareness. Wonderful. Well, I'd like to thank our panelists so much for sharing so many rich insights around careers in positive health. So my thanks to Professor Ciaran O'Boyle, to Ruth Kelly, and thanks to Dr. Mark Rowe.
My pleasure. You know, Plato the philosopher once said that all learning has an emotional base, and when we take better care of our emotional well-being and our mindset and our physical health, we're better able to learn.
A lovely way to end our conversation. Thank you, Mark. And our thanks to everyone who has listened to our panel discussion. As Professor O'Boyle said, if you would like to learn more about our programmes and to sign up for the Science of Health and Happiness programme, please do go to our website www.rcsi.com/CPHS. Thank you so much.